Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. Welcome back to our episode of how to find a pediatric doctor. As a new mother, I had to struggle with this myself. And as a new mother, there were a lot of advice given to me. Let's just say that. Anybody hear that? Any echo with anyone's experience out there? But luckily, I have the upper hand of having folks in my community like Dr. Hervey Froehlich, who were, I feel like I can reach out to you, Hervey, when I need something, right?
It's true.
Yeah,
yes.
When you're not camping or
right. That was a great trip, by the way.
I'm so glad that one of us likes camping. But we're back in the studio with none other than our wonderful governing board member, Dr. Hervey Froehlich, who's brilliant and an amazing pediatric physician. And he's going to kind of help us lay some structure and groundwork for new moms like me, new parents out there. Well, would you say I'm a senior mother now? Like pretty senior, pretty junior? 2.5 years in?
2.5 years in. Late childhood?
Okay. All right.
Mother?
I'll take it.
Using the developmental scheme that I'm used to. Infant, child, adolescent.
Okay. We're still in the infant.
Late child. No, you're late child as a mother.
Okay.
As a mother.
Okay.
I'm not talking about your son.
Okay. I'm talking about
toddler.
me.
Yeah.
Okay. Yeah. Wonderful. I'll take it. But I'm wondering if you could reintroduce yourself to our listeners and just give us a quick rundown of where you used to practice, why you went into pediatrics, other than the obvious, they're adorable and you want to squeeze them and love them. So that's obvious. But if you could reintroduce yourself and give us a little rundown on why pediatrics.
Okay.
Yeah.
Well, my name is Hervey Froehlich. I grew up on the East Coast and did all my education and training more or less East Coast and the South. Mm-hmm. And deciding to be a pediatrician wasn't that difficult for me because I liked kids. Mm-hmm. And I liked being a servant to families and to the community. Mm-hmm. All physicians go through medical school. Mm-hmm. So they get to experience the whole range of different practices. Mm-hmm. So I'd say I enjoyed the pediatric ones the most.
Okay.
Tempted to do a couple of other things, but finally decided pediatrics was what I wanted, and I'm glad I did.
Have you been satisfied with that decision?
Yes.
Yeah.
I retired 1.5 years ago. Mm-hmm. No particular pressure, but it seemed like the right time after 35 years of being a pediatrician. Wow. I still have my license, so I can volunteer here and there, like on the 3W board. Mm-hmm. And so I did a number of things along my career. I was an infectious disease specialist for a short time. Mm-hmm. Then I transitioned to general pediatrics, and I did that for 10 years in California, Fresno.
Wow.
Then we moved here, and I worked first at Group Health and Kaiser for 23 years.
Wow, you were at Kaiser for that long?
Mm-hmm. Yeah.
Wow.
Yeah.
I can't imagine doing anything for 20, 30 years.
Well, you will. You get to experience it.
My husband and I just celebrated our 10 year, and I'm like, whoa,
yeah. That's great, isn't it?
That's crazy. I'm like, are we done? Are we getting to the end here or what?
Well, the Carters were married for 77 years, bless their hearts.
Wow. That's crazy.
Yeah.
Yeah. My grandparents were married for 64.
Yeah.
Yeah.
So it is possible.
It is.
Can
It
be
just
done.
seems so crazy. But, well, thank you for giving us a quick rundown of your background and your experience and why you picked pediatrics. What in your opinion, are some struggles parents go through when finding a pediatric doctor?
Yeah, the kind of struggle you're talking about is mostly with first-time mothers.
Yeah.
So there's the whole pregnancy deal,
Mm-hmm.
which I didn't take care of pregnant patients.
Yeah.
I take care of the babies after they come out.
Yeah.
Just to be clear.
Yeah.
And oh yeah, I should mention this too. Pediatricians take care of babies from birth till when they leave our practice, and that varies.
Okay.
Often it's during adolescence. They feel like, oh, I want to see someone who doesn't have a bunch of kids in the waiting room. Or it's at end of high school. Or it's when they come back from college and they have a beard and they're a lumberjack. And I tell them, you know what? It's time.
That was me.
Yeah.
I did not want to leave my pediatrician. She was awesome. And eventually she had to say, Helen,
Right.
my scope of practice has ended with you. You need to go somewhere else.
Exactly.
But I was like, but you know me the best. Yeah. Yeah. So
it's a wonderful transition conversation.
Yeah. But you've had those conversations through the years?
Oh, yes. Oh, yeah, yeah.
And have they always gone pretty smoothly or?
Yeah, no one has broken down and cried.
Okay.
I got a couple of hugs, and
Aww.
not from the lumberjack. So yeah, it's for as far as picking a pediatrician, a pediatric doctor.
Mm-hmm.
It sometime during pregnancy, the couple realizes, oh, wait a minute, this is going to be a baby.
Yeah.
Who is outside of us, me, the mother.
Yeah.
And I have to do something with this baby.
Mm-hmm.
So they figure out how to go to a doctor.
Okay.
The choices are there's a little bit of a range. Family practice doctors do see kids, and most of them like to see kids.
Okay.
And they're more common in the Washington state than many other states. And then there's pediatricians who are trained specifically with just kids, again, from birth through adolescence.
Okay.
So that's the basic category to pick first. And then the next decision is really governed a lot by insurance. People with low or no income, their kids are going to qualify for what's called Apple Health here, or Medicaid in other states. So they will be able to find someone, but that choice is going to be governed by which groups, which practices accept Medicaid. Then the other practices will generally say any type of insurance is fine, but they often exclude Apple Health, Medicaid. When they say we accept most major insurers, that almost always means they're not accepting, Apple Health. But some pediatric offices are different because we know that as many as a third of the kids in the state are born to low-income families. So that's who we see. We see kids.
Right. Is there a difference in quality?
No. As far as training, we all go through medical school, then through an approved residency, and then get credentialed. So quality is very hard for a layperson that is a non-medical person to understand. It is the interaction. It is the Yelp reviews, the interpersonal stuff. But even more than that, I would say you have to know, does this person listen and think and advise in a logical way, in a scientific way? So it has to be more than just, good interpersonal relationship.
Yeah. Yeah. I remember going through the process of picking a pediatrician for my own son, and it was really helpful to go onto the hospital or the clinic's website, and there's a biography of the physician. And what we decided was, because our son is adopted, we really gravitated towards the doctor that adopted himself. A little boy. And so we're like, this feels good. Let's see, let's see how this would go. And we've been with him ever since.
Oh, that's
But that was kind of our process.
Sure. anyone who works in a clinic that is more than just a one-person office, which is pretty much the norm now.
Yeah.
It's going to be very rare to find someone in a one- or two-person office. They're going to have a website and they're going to have a bio. And generally, we were asked to write our own bios.
Oh,
So that's where that information comes from.
Okay.
So that's a little feedback, of course, from an editor. But yeah, that's how that person wants to present themselves. And that's a good way to get to know someone.
Yeah, that was good for us to know. And then what other tips would you give to parents on how to find a good pediatrician? What are some signs or this is a positive relationship that we should continue? Or what are some red flags that parents should look out for on their first or second appointment with the pediatrician?
That ties into the question that Dr. Mead answered last month about meeting and finding someone who's compatible. There are meet and greet visits at many offices, so you can go for a 15, 10-minute chat. You're going to hear pretty much the same thing.
Okay.
The common questions are, do you support breastfeeding? Well, duh. Do you give immunizations here? Yes. Do you like immunizations? Yes. I'm a pediatrician. How can we reach you? Well, you can call, make an appointment, do email, So there is some interpersonal stuff that's going to happen underneath the superficial questions that you're going to know, this person listens to me, or, I could never see myself having a conversation about my child with this person. One thing you should not look for very hard is a male pediatrician. It's about 1 in 9 now going through residency.
Really?
8 women to 1 man in most residencies in pediatrics.
Wow, I did not know that.
It has really flipped. There was always more women in pediatrics than, say, surgery.
Okay.
But now it's gone even more to that extreme.
Wow.
So don't beat your brains out looking for a guy. Unless it's a dinosaur like me. He's still practicing.
Okay. Well, that's really interesting because I was just going to ask you, I was told as a new mom that if you have a boy, you need to look for a male pediatrician. If you have a girl, you need to look for a female pediatrician.
Right.
And you're saying that's not even possible sometimes.
Sometimes, so depending on the clinic you choose, the office you go to, that won't even be possible.
Okay.
Everyone would love to have a variety of everything.
Okay.
Different racial backgrounds, different ethnic backgrounds, different gender, male, female. But it's just not possible. It's the way it is.
If there was a possibility, is there an advantage for that child to be seen by someone that has the same gender as them versus the other?
I don't really believe that.
Okay.
Yeah, I think it's fine. I'll tell you though, most adolescent girls would prefer to see a woman.
Okay.
So that's pretty easy.
Yeah.
And the guys, they're not too worried about it
Not
until
too
they're sports
picky.
physical. And then they can endure that and then they move on.
Okay. Yeah, that's one of those things that,
All right.
yeah, as a new parent that
Right.
I was told. So
Yeah.
it didn't, personally, I didn't have such a hard time finding a male physician.
Oh, good.
Yeah.
Yeah, that's great.
Yeah. It was interesting.
Yeah.
Are there any resources that you know for those who may be, like you mentioned, low income or uninsured or on Apple Health that you could suggest to a parent?
Well, first would be the Washington Health Plan Finder. So that gets you connected to the whole system. It's really important because having insurance for kids opens the door to well visits. So we haven't talked much about, the office itself.
Okay.
But pediatric practice consists of about half well visits and half urgent visits.
Okay.
So you've got, 2-month-olds, 6-month-olds, 12-year-olds coming in for their well visits. And then in between, you're seeing ear infections, respiratory infections, your ADHD patients, your patients who are depressed, and, the whole variety, post-concussion. I mean, a full-orbed pediatric practice includes all of that.
Okay.
Some offices have elected to move most of the urgent visits to their own urgent care.
Okay.
Like some of the larger offices will have a separate urgent care set up.
Uh-huh.
And they just assume that you won't be able to get in to see your pediatrician for same-day visits or within 2 days.
Okay.
Most of the things that happen to kids that are acute, you want to be seen the same day or the next day.
Okay.
Have some contact. So that's a little bit of a difference between offices. You can look at that.
Okay.
To see characteristics of an office.
Through your practice, were there trends that you saw that you were able to observe and pick up in questions new parents ask their pediatrician? Like, what's like the most common thing that people asked you when they bring their newborn in and is like, what do I do?
Right. What do I do?
Yeah. Why
How
is
do I
it?
hold this baby?
Yeah. Why is it?
They're usually past that stage already.
I don't know. When you're sleep deprived, you're kind of like,
that's true.
I don't know what to do.
I had a friend say, we were sleep deprived for the first 10 years. And I recommend that everyone approach having a kid that way.
Yeah.
Not bad advice.
Yeah. No, you're not bad at all.
Yeah.
But what were one of those first-time parent questions that you got very often?
Well, the obvious ones are, is everything working?
Okay.
Right.
Okay.
All the fingers and toes and breathing and alertness and all that kind of stuff.
Okay.
So once you get past that, then you deal with why is there a red spot on the diaper? In the first few days of life, there's a crystal that has a chemical reaction with disposable diapers that turns urine red.
Oh.
And it's a very shocking thing for a new parent.
Okay.
Why is my baby bleeding?
Yeah.
But it's not. It's just it's been there. It's who we are as humans. We produce this crystal as newborns.
Yeah.
And disposable diapers revealed it.
Wow.
So there's one. That's a common one.
Okay.
Why is my baby's poop so green? That's a great one. My standard answer was, you don't need to worry about the color unless it's red or black or white. Anything other than those colors, you're good.
Okay. What is your opinion about diapers? Disposable or reusable? Do you have a preference as a...
I have no preference. It's a lot easier to throw a diaper away.
Yeah.
But that is it's not a very ecologically permanent, sustainable approach.
Yes.
At some point, I think we'll have a better technology than that. But right now...
Like biodegradable ones or...
Yeah, or who knows, something that you got to deal with the poop.
Are there any special diaper rash ointments that you like, that have worked, that you've seen work better versus others?
Almost all of them have the same ingredient in them. So the brand doesn't make too much difference. Okay. What does count is the contact time of moisture against the skin. So that's where the disposables are great. If you've been using cloth diapers and there's a bad rash, switch to disposables for 5 days and as you treat it, and then that'll help. Yeah. But most commonly it's irritation from just the wetness, and then secondly, a yeast infection, which is easy to treat with over-the-counter yeast creams. Okay.
And what's your one-liner advice that you give to new parents?
This is a new human being. You now have responsibility for teaching him or her how to be a thriving human. It's a long process full of ups and downs, and I'm here to help you along the way, but you're the ones who are raising this child.
Does that usually make them feel better?
I don't think so. It's like, deer in the headlights, eyes get wide. What have I done?
Sometimes I think about how my son loves to watch a lot of nature shows.
Oh, yeah.
And sometimes we watch them, giraffe give birth, an elephant give birth. Sometimes I'm like, human babies are so useless. They don't do anything when they come out.
That's exactly what I was thinking of this morning. As I was thinking about talking today is you look at a horse. That was the example I was thinking of because I've seen pictures of horses being born.
Yeah.
Within a few minutes, they're standing up. They're running around in the field.
Yes.
And they're, except for the fact that they're still on mother's milk, they're pretty much the way they're going to be their whole life.
Right.
But there's so much more that goes into being a human.
Yes.
The way God made us, it's just amazing.
Yeah.
That it takes 18 plus years of close parenting.
Yeah.
That changes over the years. Every stage is different.
Well, my mother doesn't think at age 18 you're done parenting.
Oh, you're not, but it changes.
It changes.
You become more of the coach.
Yeah. Yeah.
That's a very interesting idea you have to go off on spring break. How are you going to pay for that?
Yeah. My mother would have just said no.
Yeah, there you go. And you would have said, okay, Mom.
Yeah. Well, I was living under her roof, so there was no fighting about that.
Right.
So, yeah. Well, thank you for your wisdom and insight on just first-time parents. I know, we get quite a few first-time parents here at 3W, and the excitement, right, of the ultrasound and being able to see their little one and seeing and the realization that this thing that's growing inside of me is going to come out and it's going to grow and I'm going to have to be responsible for it. It is nothing like driving home with your newborn in the backseat going, oh my God, we can't give it back. We can't undo this. The ship has sailed. And it's like a feeling I've never experienced before.
Yeah.
Never before. But would I do it again? Probably.
Great. That's a great answer and that as pediatricians, family practice docs, NPs, seeing kids, we want to come alongside parents to encourage every way they can to enjoy it and also see how serious it is.
Yeah. Yeah. It's awesome.
It's great.
It's really awesome.
It is awesome. That's a good word for it.
Thank you, Dr. Hervey.
You're very welcome. I'm glad to be here.
Yeah. Well, there you go, listeners. Thanks for tuning in on this episode on how to find a pediatric doctor for you and your family and your little ones. Thanks so much for listening, and I'm sure we'll have Dr. Hervey back for a variety of other topics, but thanks for tuning in today. And I don't know about you, but Dr. Hervey has a way of talking that makes me just feel so relaxed and as I'm drinking my tea today. So hopefully that will make you feel that way too and not panic about being a new parent. Okay, well, good luck. Bye-bye. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.